Thanks for tuning in for Health Insurance 101. We are the Oregon Health Insurance Marketplace. Our main goal is to help Oregonians find their best affordable health coverage option and understand how to take advantage of all of the great included benefits.
Today we will be talking about the different types of health coverage available to Oregonians, some of the myths surrounding health coverage, some of the rules, and how to get ready for open enrollment.
My name is Amy Coven, and I am an Outreach and Education Coordinator for the Marketplace. While I've done outreach in most areas of Oregon, I'm currently working mostly in the Willamette Valley and Lincoln County. I'm passionate about my role with the Marketplace because prior to working in this position, I knew very little about health coverage. I didn't know there was a difference between Medicare and Medicaid or what the premium or deductible was. While working in my previous role, I learned a great deal about health coverage options, financial assistance, and eligibility, and how health insurance works. I am passionate about sharing this information with other Oregonians to clear the confusion and make everything easier to understand.
And I'm Janine Scholander. I'm also an Outreach and Education Coordinator with the Marketplace and mostly work in the North Coast region of the state. I'm driven in my position and in the work that we do. I have a background in healthcare and have years of experience seeing the impacts of being uninsured and implications that brings to families financially and in the means of their health. In my current role, I feel rewarded seeing the positive impact our work has on the community, either through educating on knowledge gaps or presenting coverage options to someone that was sure they had none.
Let's kick off with talking about what health insurance and health coverage is. Many folks have heard the term Obamacare, which actually refers to the Affordable Care and Patient Protection Act. We call it the Affordable Care Act, or ACA for short. The most visible parts of the Affordable Care Act went into effect in 2014 and introduced new consumer protectability programs. One of the most well-known parts of the ACA is that people cannot be denied coverage or charged more for plans based on pre-existing health conditions. This is really huge because there was no nationwide ban on denying someone with health coverage for everything from cancer to being prescribed ibuprofen. Or maybe the plan would cover you but would add on extra fees and charges to do so. This is no longer allowed. Health status questions can no longer be asked on applications for health coverage. Another provision of the ACA is that premiums can only be determined based on how many people in your family are enrolled in the plan, how old each enrolled member is, whether those family members use tobacco, and where you live. Location factors in because provider prices vary regionally, and it's those costs that eventually show up in premiums. In addition, there are fewer members enrolled in rural areas, so the costs are spread among a smaller group or risk pool. We won't go into detail about all of the provisions, but some of the other things that the ACA did include mandated that all health insurance companies must allow parents to keep their kids on their plans until they're 26 if they choose to, strengthen the Medicare drug program for seniors, and prohibited gender bias in benefits.
Speaking of benefits, all plans available on healthcare.gov must include 10 essential health benefits with no annual or lifetime limits. These benefits are really large umbrellas with many services that fall under them. For example, emergency services, maternity and newborn care, mental health and substance use disorder services, and prescription drug coverage are just to name a few.
Included in the essential health benefits are a long list of preventive services that are covered at no charge to the member as long as you're visiting an in-network provider. These services are intended to help keep you healthy by catching issues before they become more serious. This is a very abbreviated list, but can give you an idea of some of the covered services. Some of these services also have special caveats. For example, diet counseling may only be available to adults who are at risk for developing a chronic disease like diabetes. You should work with your doctor to determine which screening tests or services you may need. And remember, it's a screening when you are healthy. It will be covered at a different level if it's a test to diagnose an illness you already have symptoms for. That's another reason to work closely with your provider when you seek preventive care.
Before we go on, we want to make sure everyone understands all of the terminology that is frequently used when discussing health insurance. A premium is the amount you pay for your health insurance plan, typically monthly. We like to compare the premium to rent because you'll pay the same amount throughout the year, but it may change from one year to the next. Coinsurance and copayment are both your share of the cost of a covered healthcare service, treatment, test, or prescription. Coinsurance is a percentage of the allowable amount billed, where copayment is a set dollar amount. The deductible is the amount you pay for healthcare services your health insurance plan covers before your health insurance plan begins to pay out a higher amount within a benefit year. The out-of-pocket maximum is the most you will pay for in-network services during a policy period, usually 1 year, before your plan starts to pay for 100% of covered services. It is very important to familiarize yourself with your specific plan's network. This is made up of the facilities, providers, pharmacies, and suppliers that your health insurance contracted to provide healthcare services. Some plans will only cover services, treatment, and prescription costs when visiting an in-network facility or seeing an in-network provider.
Let's dive into the three main health insurance options that our team works with to some degree or another. The first is the Oregon Health Plan. This is a state-based medical coverage called Medicaid. The Oregon Health Plan is administered by Oregon's Department of Human Services and Oregon Health Authority. If you're found eligible, you will have no premium, and the services are mostly 100% covered, so there are typically no out-of-pocket costs. Eligibility for the Oregon Health Plan is largely based on family income, tax household size, age of the applicant, and the applicant's immigration status. You can apply and enroll into the Oregon Health Plan at any time throughout the year.
When the ACA passed, some states chose to expand Medicaid. Oregon was one of them. But what exactly does this mean? The expansion of Medicaid means that more Oregonians have access to affordable coverage. Any Oregonian that applies and falls within eligibility guidelines is placed on OHP right away. Prior to the expansion, many adults who were found eligible were placed into a lottery. As people came off the Oregon Health Plan, new people could be added on. This is no longer the case. If you're found eligible, you are able to take advantage of the benefits right away. Eligibility income limits raised to 138% of the federal poverty level, which is a huge benefit for Oregonians. Lastly, the Oregon Health Plan now offers more comprehensive benefits, especially for adults.
Next up, Medicare. This is a health insurance program for people who are 65 years of age and older, and certain people under age 65 with disabilities. These folks usually have been on Social Security disability for more than 24 months. Medicare is a program that is administered federally, so you'd sign up through Social Security for Original Medicare. Social Security will send you an ID card with your Medicare beneficiary number. Generally, you sign up for Medicare during the initial enrollment period, which is the 7 months surrounding the month you turn 65. So, if you turn 65 in August, you can enroll between May and November of that year. But we recommend taking action in the first 3 months so your coverage starts the first of the month you turn 65 or become eligible. There are also 2 other periods when you can sign up or make changes. The general enrollment period, which is January 1st through March 31st each year, and after employer group health coverage ends.
We aren't going to get too far in the weeds with Medicare because it's a very complex program, but let's go over some of the highlights of each part of Medicare. Part A is what we call the hospital coverage of Medicare. For most people, there is no premium, but it depends on if you or your spouse have earned enough work credits. Part A will cover care if you're admitted to the hospital, hospice, or home health. Part B is what we call medical coverage because it covers emergency room and urgent care visits, visits to your primary care provider, lab work, tests, durable medical equipment, and prescriptions that you can't give yourself. There is a monthly premium of about $135.50 and a deductible of $185 per year. These amounts do typically increase a little from year to year. Part D is prescription drug coverage and covers all self-administered drugs. These are private plans, and out-of-pocket costs like premiums, co-pays, and coinsurance can vary. Part C is also known as the Medicare Advantage plans. They are also private plans with varying out-of-pocket costs and covered services. Medicare Advantage plans are similar to employer plans, where there are specific networks, covered services, and out-of-pocket costs. Many of these plans include prescription drug coverage and other preventative services not covered by original Medicare, like dental, vision, or hearing. The empty triangle on the top represents Medigap plans, also called supplement plans. These plans fill in the gap for charges that Medicare doesn't cover, like deductibles and coinsurance for Parts A and B. These plans pay after Medicare pays their part, so there is no special network to consider, but the plan premiums can vary largely based on age, gender, and health history.
Before you become eligible for Medicare, Medicaid is a benefit plan that provides health coverage. Many people know this program as the Oregon Health Plan. Once you are eligible for Medicare, Medicaid shifts to a financial assistance program called the Medicare Savings Program to help pay for things like Part B premiums and out-of-pocket costs. This program is available on a sliding scale. The state will help pay for more costs associated with Medicare if you have lower income. If you are below the lowest income level, you qualify for both full Oregon Health Plan benefits alongside Medicare. If you qualify for QMB coverage, the state will pay your Part B premiums and out-of-pocket costs. And with SMB and SMF, the state will pay your Part B premium, but you are still responsible for any out-of-pocket costs like deductibles and coinsurance.
Individual plans are insurance plans that can be purchased through private insurance companies or the marketplace at healthcare.gov. These plans can be purchased for an individual policyholder, a couple, or to cover a family. Although you can purchase plans directly through an insurance company, you can only apply for and receive financial assistance through the marketplace. It is important to ensure that you are shopping at healthcare.gov. There are websites that reference Obamacare or look like the marketplace and are not legitimate. You must shop at healthcare.gov to be eligible for the financial assistance.
You can apply and enroll or change plans each year during the annual open enrollment period, which is November 1st through December 15th. If you enroll before the December 15th deadline, your coverage will start January 1st.
You can only shop and enroll in a plan outside of the open enrollment period if you experience a qualifying life event, such as having a baby, getting married, moving, or losing your health coverage involuntarily. Once you report your life event to the marketplace, they will tell you if you qualify for a special 60-day enrollment period. Make sure to check your paperwork to see if you need to submit any documentation to prove your life event.
Financial assistance is only available through the marketplace and is available on a sliding scale. The lower your income, the more assistance you qualify for. There are two different types of financial assistance available through the marketplace: premium tax credits and cost-sharing reductions.
When you fill out an application, the system will calculate what is considered to be an affordable premium based on the information you enter. It then compares this amount to the cost of the second lowest cost silver plan in your area. If the second lowest cost silver plan is more expensive than what is considered affordable for you, it subtracts the two to determine how much in premium tax credits you qualify for. You can use those tax credits on any plan available to you through the marketplace. If you choose a plan with a lower premium, you will pay less for the premium, but other out-of-pocket costs may be more expensive. If you choose a plan with a higher premium, you will pay more for the premium, but other out-of-pocket costs may be less.
Premium tax credits can be applied to the premium throughout the year or claimed at the end of the year on your taxes. These tax credits are always reconciled at the end of the year, so it is important to update the marketplace if you have any changes that could affect your eligibility, such as income, address, or family. If you end up making more money throughout the year but do not report the increase to your income, you may have to pay back some of the credits you used throughout the year. The IRS will add this to any additional tax you owe or take it out of any refund amount. However, if your income ends up being lower throughout the year than you estimated on your application, you may get more credits back on your taxes. You will not receive a separate check for any additional tax credits you are owed, but it will be added into any refund or taken out of any other tax payment you have due.
The second type of financial assistance is called cost-sharing reductions. If you qualify, you can lower the amount of out-of-pocket expenses you pay, including co-pays, deductibles, and your maximum out-of-pocket amount that you pay throughout the year. These reductions come in 3 tiers, with deeper savings coming to you if you have a lower estimated income amount. You must enroll in a silver-tiered plan in order to take advantage of these savings, unless you're enrolled in a federally recognized tribe.
Let's talk about some of the myths that our team frequently hears about health coverage and why they may not be true. The first is that costs for health insurance are high and that there's no help to pay. Health insurance premiums are typically based on risk pools. The more healthy the group of people that are enrolled in health coverage is, and the less they have to use their coverage, the more premiums will go down. In addition, as we talked about, Oregon has expanded Medicaid to ensure all eligible low-income individuals have access to coverage that is affordable to them. Also, financial assistance is available for Medicare beneficiaries through Medicaid programs known as the Medicare Savings Program. And of course, financial assistance is available through the marketplace on a sliding scale. The lower your income, the more assistance you can qualify for, including both premium tax credits and cost-sharing reductions.
Sometimes we hear that folks think that it's less expensive to not have coverage. Let's look at some scenarios. In the first example, we are looking at a family of 4, ages 38, 37, 10, and 8, living in rural northeastern Oregon. This family earns about $60,000 a year before deductions and taxes. This means the family will qualify for $697 per month in tax credits and cost-sharing reductions. This means their monthly premium is $373 for a silver level plan with a maximum out-of-pocket of $12,600 for the entire family. In the second scenario, we are looking at a single 25-year-old male with no dependents who also lives in Northeast Oregon. He earns about $25,000 a year gross. He is eligible for $299 in tax credits per month in cost-sharing reductions, so a silver plan will cost about $143 a month. The most he will pay out of pocket for services is $6,300. Now you may be thinking, so what? That is a lot of money. Well, it may seem like it, but let's look at the estimated median cost of some standard procedures in Oregon. Let's say that the otherwise healthy 25-year-old has gallbladder issues. It may run him almost $25,000 to get his gallbladder removed without insurance. That's a hefty bill that could be avoided, not to mention all of the free preventative services available even if he has not met his deductible.
Another thing we hear frequently is that the system is so confusing and that there's no one to help. The Oregon Health Insurance Marketplace is here to help find someone locally who can sit down with you and walk you through the process. Insurance agents can give personalized advice about which plans may be best for you and help you apply and enroll in coverage. Community partners are available to assist with the Oregon Health Plan application process, and some partners also help with the marketplace applications. SHIBA counselors are available to provide assistance with Medicare questions. If you want to find local help, you can visit our website at oregonhealthcare.gov. Keep in mind that the official certified assisters will work to help you find the plan that meets your health needs. If you want, they might help you get signed up through healthcare.gov. They will not try to sell you a particular plan or ask for money to help you. Insurance agents and SHIBA counselors will also not ask for payment to assist you. If someone does charge a fee to help you, chances are they're not an official trained assister.
Another thing that we hear is that health plans are expensive to use. Really, understanding your plan is what is included is important. As we talked about before, there are many preventative benefits that you can take advantage of for free, as well as a whole bunch of essential health benefits, which are always covered by marketplace plans. Not to mention all of the savings you can get on out-of-pocket costs if you qualify for cost-sharing reductions and enroll in a silver-tiered plan.
Another thing we hear from folks is that they want to keep their marketplace coverage when they become eligible for Medicare because they think it is less expensive. The most important thing to remember is that if you're eligible for premium-free Medicare Part A, you will not be eligible for financial assistance through the marketplace. Most folks are eligible for premium-free Part A, so most Medicare beneficiaries are not eligible for any assistance through the marketplace. If you do use tax credits for a marketplace plan throughout the year, but are eligible for premium-free Part A, even if you choose not to enroll, you will have to pay back the tax credits at the end of the year. Also, it is important to remember that there may be penalties if you enroll in Medicare Part B or Part D late, and some of these penalties never go away.
We also hear that folks believe the Oregon Health Plan or Medicaid is not good coverage and has terrible benefits. Remember when we talked about the Medicaid expansion? This ensured that all OHP enrollees are able to take advantage of a robust group of benefits. You can find out more information about the covered benefits by visiting OHP's website at ohp.oregon.gov.
Another thing that we have heard is that folks do not want to sign up for OHP or Medicare because they are worried that they will not be able to see their typical providers or have to go to special facilities for care. While it is true that OHP and Medicare have networks to consider, typical family practitioners that accept private coverage will often also work with the Oregon Health Plan and Medicare. Also, the facilities that you can visit are often the same as private coverage as well. This means you will typically be able to visit your local hospital in the event of an emergency. In addition, the level of care that you receive will be based on the care that you need and capacity, rather than the coverage that you have. The doctor won't look at your insurance to determine how to best treat you.
Next, we are going to talk about the rules of health insurance, and more specifically surrounding eligibility for the Oregon Health Plan, the Marketplace, and the Medicare Savings Program. Eligibility for these programs are largely determined by the number of people in your tax household and your household's income. Those numbers are compared to the federal poverty limit, which is set by the Department of Health and Human Services annually. The income limits for the Oregon Health Plan are higher for children through age 18 and pregnant women than they are for adults age 19 to 64. Keep in mind that the Oregon Health Plan is available to all children regardless of immigration status as long as they meet the other eligibility criteria. Adults must still meet immigration status requirements as well as other eligibility criteria. For more information, visit ohp.oregon.gov. The eligibility income limits for the Marketplace start at 139%, although some folks can shop and qualify for assistance below 138% if they do not qualify for full OHP benefits. You'll notice that someone who falls between 139 and 250% of the federal poverty level can be found eligible for both premium tax credits and cost-sharing reductions. The Medicare Savings Program is available in tiers to many Medicare beneficiaries below 150% of the federal poverty level, as we discussed before.
Maybe now you realize that you might qualify for the Oregon Health Plan. So what's next? The first thing we recommend doing is to make an appointment with a local community partner organization who can help you through the application process for free. These partners are trained and skilled in everything OHP, so they know how to overcome any obstacles or steps you may encounter. You can find a community partner by visiting oregonhealthcare.gov/gethelp. The next thing you'll want to do is to gather some documents that you may need during the application process, including identification for you and all of your household members and documents showing any income you've had recently.
To apply for the Oregon Health Plan, you can visit one.oregon.gov, where you can create an account or log into an existing account. We highly recommend getting help from a local community partner organization to make the process easier.
If you don't think you'll qualify for the Oregon Health Plan, you can apply through the Marketplace. We highly recommend making an appointment with a local insurance agent who can help you apply, shop for plans, and enroll through healthcare.gov. Because open enrollment and special enrollment periods are short, it's important to make an appointment as soon as possible to make sure you can get in before the deadline. You can find a local insurance agent on our website at oregonhealthcare.gov/gethelp. After you make an appointment or before you apply, it is helpful to gather information that you may need during the process. This includes identification information for all of your taxed household members, information about any income that you may earn this year, documents that support any life change, and a list of your preferred providers, facilities, and any prescriptions you take.
To apply through the marketplace, visit healthcare.gov. Make sure your browser shows healthcare.gov as the web address to avoid any complications. On healthcare.gov, you can create an account and then apply for financial assistance, compare plans, and enroll in coverage. Make sure to make note of your login information, as you'll need this to report any changes throughout the year and to renew your coverage next year. Again, we highly recommend getting help from our local insurance agent to make sure your application is completed correctly and that you're choosing the plan that best works for you and your family.
Have questions? We are here to help. The Oregon Health Insurance Marketplace is a state agency who can help give you information about your options and help you find local assistance. We are available toll-free at 855-268-3767 on Monday through Friday from 8 a.m. to 5 p.m. and online at OregonHealthcare.gov.
Oregon's Department of Human Services and Oregon Health Authority administers the Oregon Health Plan and can help answer your application questions by calling 1-800-699-9075. This number is also toll-free and open Monday through Friday from 8 a.m. to 5 p.m. OHP information can also be found online at ohp.oregon.gov.
Last but not least, if you have questions about Medicare and what options are available, we recommend meeting with one of our senior health insurance benefits assistance counselors. You can find a local office by calling SHIBA at 800-722-4134 and typing your zip code in your telephone keypad at the prompt. We are also available to answer questions at our state office by calling the same toll-free number on Monday through Friday from 8 a.m. to 5 p.m. You can also find a whole bunch of Medicare information by visiting MedicareStartsAt65.org.
Thank you for watching this video. We hope it clears up your questions about health insurance options in Oregon. If you need help finding a local community partner, an insurance agent, or would like more information, check out OregonHealthcare.gov. Visit our YouTube channel for more helpful videos.